So today we are going to discuss a new topic, ADHD, Attention Deficit Hyperactivity Disorder. A disorder in which a child is not able to pay the attention. He is very much inattentive. Okay? How can you understand the inattention? Suppose you have given a task to a child. He starts the task but will not be able to complete. Suppose a teacher is teaching in the class. Okay, all the students are concentrating in the class, but the child of ADHD, he is not able to concentrate in the concentrate in the class. Okay, not able to pay the attention. Okay, suppose he is studying. He distracted very easily by the external environment. Easily forgetful child. We will look all these symptoms in the details. Okay, the child is very hyperactive, he is very restless. Okay, so these are all the symptoms of ADHD. We will look what is ADHD, what are the signs and the symptoms of ADHD, duration criteria and cutoff age to diagnose ADHD. Okay, so let's start. We will look all these signs and symptoms with the help of the diagrams to clear our concepts. You can see this diagram. A child, he is disturbing the other child. Okay, he is very much hyperactive. You can see in the diagram the child is disturbing others. Okay, if this child is disturbing all the time to all his batchmates, okay, and he is very restless, he keeps on disturbing others, keeps on roaming in the class, the child is considered as the hyperactive child. Okay, you can see this diagram. A teacher is teaching in the class but the child is not able to pay attention. Okay, he is thinking some other thing but he is not able to pay attention in the class. That is inattentive child. There is a attention deficit. Okay, so ADHD is the attention deficit hyperactivity disorder. So let's start. Attention deficit hyperactivity disorder, the older name was minimal brain dysfunction. It's a neuropsychiatric disorder most common in the children's, more in the males than the females. How can you understand this child is of ADHD? There are certain signs and symptoms which we have seen. The child is inattentive. Okay? Inattention. Usually the first symptom to be noticed. There is a distractibility is there, restlessness is there, the child is making more mistakes, focusing problem, avoid the task, okay, and very much forgetful. Okay, you can remember inattention with the help of the mnemonic solid. S means it start the task but will not complete through. O is organization of the task is poor. L is losing things easily. I is instructions are poorly followed. D is distracted easily by the external environment. Hates doing the task requiring attention, not listening in the class. A child is easily forgetful and poor note taking. Okay, these are all considered as inattention. Okay, when the child is starts the task but not able to complete, not able to organize the task, losing things easily, very forgetful, he is getting distracted very easily by the external environment, hates doing the task which require attention, not listening in the class because of lack of attention. Okay, so remember attention deficit, inattentive. Okay, the first terminology is clear, attention deficit. Okay, how can you understand the child is inattentive? Okay, there are a lot of symptoms are there. Second is hyperactivity disorder. Hyperactivity, impulsivity is there. There's a lot of restlessness is there. You can remember by the mnemonic worst fail. W is waiting for the turn is poor. Suppose a teacher asks any question in the class, he is not able to wait for his turn. Just raising the hand, yes ma'am, yes ma'am. He is not able to wait for his turn. On the go driven by motor. R is restlessness, S is squirms on the seat. T is task excessively not appropriate to social content. Okay. F is fidget hand and feet, answer blurt out, interrupt conversation, loud noise in play and situation. These are all hyperactivity. You can see the type of ADHD, predominantly inattentive type of ADHD, where a child is not able to focus, lack of focus, disorganization, distractibility, trouble following direction, and very much forgetfulness. If there is predominantly hyperactive impulsive type of ADHD, there is a impatience. For example, if a teacher asks anything, the child keeps on raising the hand, he is not able to wait for his turn. Interrupt others, disturbing others, always on the go, excessive activity, difficulty paying attention, and fidget. If there is a combined type, there will be both inattentive and impulsive or hyperactivity symptoms. So, the sign and symptoms of ADHD are inattention. Usually, the first symptom to be noticed, distractibility. There is a lots of restlessness. Child makes more mistakes. Lack of concentration. Focusing problem is there. Avoid the task. Okay, because of lack of concentration, forgetful. He forgets very easily. Second is hyperactivity. Hyperactivity can be understood child by the activity of the child. He is excessively active in the class, always keeps on roaming, keeps on disturbing, fighting, jumping. Okay, very much impulsive. Inability to wait for his turn, interrupts in between. As we have seen the example of the teacher who is asking the questions in the class, the child is keeps on raising the hands, not able to wait for his turn. The second one is impulsiveness, inability to wait for his turn. Okay, the next is duration criteria. All these symptoms should be more than 6 months. Cutoff age to diagnose ADHD. Symptoms must have an onset less than 12 years of age. 40 to 50% of ADHD can persist and this can grow to the adulthood also. But there we should be able to understand some other symptoms also. We will look into those symptoms also. Okay. We have seen inattention and hyperactivity, how the child will be, how we can understand the child is inattentive and hyperactive. Then there are certain neurological examination like soft neurological sign. Suppose a child, 9-year-old child, and if you are asking to draw a circle, he is not able to draw. Okay, and right and left discrimination. So there is difficulty in copying age appropriate figures. Okay, age appropriate figures like we are asking for a 9-year-old child to draw the circle and he is not able to draw the circle. He is not able to draw the rectangle or the square. Okay, and there is a left right discrimination. He is not able to understand what is left, what is right. Okay, 40 to 50% of the children, adults with ADHD. What are the sign and symptoms? Additional sign and symptoms. Impulsiveness will be there. Mood changeability is there. There is a disorganized, not able to organize anything. Rage, lots of anger. Okay. Hyperactive, suppose there are two child. One is suffering from ADHD. Okay. So what he is doing, he keeps on disturbing the other child. Okay, so what will happen? The parents come and scold the child who is suffering from ADHD because they don't know. Okay, their child is suffering. Okay, so what the child will do? There are lots of anger is there. It's okay, raise. Procrastination keeps on delaying the task. Stress intolerance. Comorbid conditions with ADHD, oppositional defiant disorders, conduct disorder, learning disorder, anxiety disorder, mood disorder, Tourette's disorder, and autism. These are certain comorbid conditions with ADHD. So, okay, now we are going to see the. Okay, so we will understand one most important thing. Most of the time, even parents, teachers keeps on scolding the child when the child is doing all those naughty things. Okay, not attentive in the class, very much hyperactive, disturbing the child. So what will happen? The child is very much child dumb, lazy. Okay, so non-medicos does not understand the child is suffering. The child always be punished by the teachers, by the parents. So what do you think the child, whenever this child will grow, he will grow and take the revenge? Okay, or he will go into the depression. Either he will take the revenge or he will go into the depression. Why their parents, why the teachers are always punishing? Okay, so those who don't understand, those who don't understand, okay, get remission, they are risk of developing the substance use disorder, particularly the alcoholism. The child will grow and he has the substance use disorder, antisocial personality disorder. Okay, he want to take the revenge. Okay, so antisocial personality disorder will be there, mood disorder, depression. Okay, he can either go into the take the revenge and he can go into the depression. So mood disorder, that is depression. So understand, ADHD is a disease of emergency and should be treated on time. If not treated on the time, there are chances of developing certain risk, like the child substance use disorder, particularly alcoholism, antisocial personality disorder, and mood disorders. What are the psychosocial interventions we can take for such childs? Social skill training, increase sitting tolerance, because the child is very hyperactive, very restless, he cannot sit in one place. So increase sitting tolerance, psychoeducation for the parents. Okay, so that they can understand their child better, not scold the child whenever he's doing anything wrong. Behavioral therapy is very much needed. Okay, so all these psychosocial interventions are needed for ADHD child. Okay, in homeopathy, if there is any homeopathic treatment, we are going for the constitutional medicine. Okay, but if we are going for the therapeutic medicine, there is a tarantula medicine is there, stramonium medicine is there, hyoscyamus is there. These are the medicines of ADHD, but we should go for the constitutional medicine for the cure to happen. So thank you so much.